So in the interest of time, we'll move on quickly then. Dr. Edel McSharry is up next, and she's talking about the partnership approach to supernumerary and internships during the pandemic. Thanks, Edel.
Yeah, the purpose of my presentation today is to talk to you just about how we use the partnership approach to maintain supernumerary and internship students in practice placement during COVID-19. And I do that by just quickly overviewing the practice placement partnership structures we already have in place, and then some of the support strategies and contingency plans we put in place. And then, and I suppose this is really important, and I don't really have enough time to do this due justice, but the lived experience in terms of the students' CPCs and academic voices of that experience of students in practice. And I did a little bit of research and accessing that from 44 students, 9 CPCs, 8 CPCs, sorry, and 12 academics. And I suppose how I'd like maybe to go away with the feeling at the end of this is a sense of pride as an educator in the colleges and educators in practice, in pulling out all the stops to maintain student learning and practice. I finish off really with maybe, you know, what have we learned, or what will we do in future, maybe a call to action. So who are we here in St. Angela's? You see our school sits on the shores of Lough I'll just go through there. As you can see there, all of in every HEI, there's how we manage to ensure our curriculums and NMBI requires are met in terms of student learning is through our structures of the local joint working group, and their offsprings of that, various and lots of partnership meetings, etc., to ensure that the curriculum needs are met, outcomes, are met, and that the student is the center of the learning experience. The student does actually learn what they need to learn in practice, and that the preceptor teaches, assesses, and facilitates that learning, and that the clinical nurse manager, person in charge, facilitates that preceptorship model so that that actually happens, and that it's all in line with that. So that's what we do normally, and it's busy enough doing that normally, but can you imagine? And yes, you can, because you all did it. The activity increased, exponential increase in activity and communication that occurred to address the evolving situation and maintain the students' well-being and maintain a quality learning environment out there in practice during COVID-19. So where we started, and a lot of times we've got communication and guidance on the measures that were necessary to maintain practice placements from our IUA group, as Mary Rose said, the NMBI and HSC and Chief Nursing Office. And we here in St. Angela's devised a specific infection practice placement, infection prevention and control policy, which set out the required declaration documentation processes, reporting and communication strategies. And then all of those partnership groups that I just outlined previously increased to weekly meetings, team meetings. Communication with students increased. There were student class weekly meetings via Teams with each year leader. Then the CPCs had really increased their individual student meetings in practice where they could, and a lot of times in community and ID settings it had to be virtual team meetings. And of course we had to implement the vaccination process, ensuring that all students were vaccinated prior to placement. There was on-site COVID testing in the hospital situation for students. There was digital submission of daily self-declaration forms and other documentation that students had to submit. And the big focus was on reallocation of student placements when insufficient supervision or reconfiguration of services occurred. And then reallocation of students when they required themselves special accommodations as a result of an off-health referral or a LENS report. And then we had to be responsive to students' feedback when they identified concerns with the clinical learning environment. And action plans were drawn up with stakeholders to address these issues. And then we had to put lots of different or escalate the student support mechanisms that we have, referral to health, resilience and wellbeing workshops were put on. The counselling service was increased and provided to students, and our college students resource officers gave advice on financial support. The student disability officer was called upon for particular student needs. And we were very responsive, both our practice partners and ourselves, to in the college, to the evolving situation, always putting the best interest of the students as the guiding principle. Some good news came out of this. We did really very fastly develop some new practice placements, so CNS placements, community settings and hubs. We did a virtual international placement. And then we had to create contingency plans for blended approaches using remote alternative placements, which focused on developing students' clinical reasoning, their knowledge, and specific skill acquisition. Okay, so let's get down to what the students thought of the evaluation of all this. Did it work? Did we manage to do it? Well, students said that they did, and they will be bringing the learning on into their professional practice. Bedside care, critical thinking, compassionate care, managing stress, ability to adapt, being flexible, teamwork, ability to think and stay calm in stressful situations. And then the caring for sick patients deteriorating from COVID-19. And not everything will be perfect, making the best of the situations and thinking outside the box to find solutions. And then, of course, a very strong thing coming through on infection prevention, the knowledge they learned, are the skills and the importance of infection prevention and control and correct use. CPCs also felt that they're, a lot of these things, but they also added creativity, and the students increased their learning in terms of social responsibility, and maybe focus on specific learning in terms of end of life loss, loneliness, isolation of patients and people under that they were learning to care about. And academics also added in the sense of power, that students actually got an appreciation of the sense of power of nurses and the central role of nursing in healthcare and society in general. They also validated that students did learn resilience, and that students also felt a great sense of pride during this time. However, it was not all a good story. There was challenges for students in practice. Some of the students' voices and CPC voices in regards to that were: students described an anxious and fearful environment where staff were anxious regarding their own health and the health of others. PPE brought us communication problems, and short staff was an issue at times due to COVID leave. Students felt isolated and scared when they had to self-isolate in rented accommodation away from their own homes. And students experienced stress when placements were unavoidably changed, suspended, and they were concerned a lot around the placement time. There's lots of different quotations there to validate that. And then CPCs and allocation team shared that they had to deal with students' anxieties and fears, communicating with students regarding IPC guidelines, and then ensuring those IPC guidelines were implemented. And ensuring supervision and preceptorship was a big challenge for CPCs, and having to reassign placements at very short notice. And academics also shared some of these concerns. Okay, so how did students overcome these challenges? Well, they felt talking to other students, reflecting on what the good they were doing for others, communicating a lot with CPCs and preceptors, using reflection, physical activity, mindfulness, debriefing during this shift with their preceptor, talking to their CPCs, their year leaders, their links about any issues that they had. And then with the help of the services in the college and in placement areas, and also classmates trying to stay in contact with each other through social media and WhatsApp groups. Okay, I asked them about their support. Did they feel supported? Well, the majority of students commented on preceptors being helpful, approachable, supportive, fantastic, addressed concerns and questions, and CPCs came out very strongly there. Fantastic, always available, supportive, understanding, who I can call. However, you can see some comments there in terms of the prep for practice, some other comments about CPCs, always there to listen and teach, support. On each placement I was on, I felt included and supported by precepts more than so need. Comments weren't all positive. There were some negative comments there in terms of preceptors. They felt that they, due to their stress, and sometimes other comments said due to the activity in the placements, were only allowed to learn basic tasks. And some comments there on that. And also some students experienced stress. I was referred to counselling because of anxiety in the college. Students' resource was a lifesaver. Okay, so what have we collectively learned? How can we plan for the future? A little call to action. What do you think? Are you surprised by anything I've shared there? I suppose I wasn't surprised in terms of the activity. I knew in the work and the shoulders to the wheel that all of our practice partners, CPCs, practice development, our academic leads, our year leaders, our program leads and directors put in, and all the work the preceptors would do. I'm not surprised by that. But I was kind of surprised around the level of stress students had. So just some ideas to start the conversation. Should we be looking at contingency plans for future emergencies? Should we be looking at e-learning, digital, virtual reality, practice placements to be developed to prepare for future emergencies and current reconfiguration of practice placements for social care? We need to invest in those. Maybe we need some investment and support to recognize simulated lab-based learning as a component of practice placement requirements, recognized as actual practice placement requirement. Should we develop a national digital online? We have the national CODs, competency assessment documents, they're fabulous. Should we make them digital? And then maybe this piece around the support and out there in high acuity areas, high activity staff shortages. Should we be looking at our clinical supervision model for those particular areas, maybe reviewing that? And then let's look at maybe for future planning, structured support for students who are in rented accommodations and who may have to isolate in the future. You know, that they are in a very different situation to the rest of healthcare workers. They are students, they are moving from placement to placement, and there's a lot of isolation, uncertainty, and support that they require. I better stop now because I'm aware that I have on the timing. So thank you very much.